My name is Hope. I'm a fourth-year vascular surgery resident. I'll be answering five questions today. The first is, what has your research experience been like? I'm in my second year of research, and I work with a collaborative team of vascular surgeons, interventional cardiologists, and data scientists and programmers. And my primary project is coming up with a natural language processing algorithm to identify patients with PAD in the electronic health record. But beyond that, I have also been examining the care of peripheral artery disease patients through multiple other methodologies and modalities, with a real focus on disparities in care and outcomes. And my experience in research at Duke so far has been one of almost an embarrassment of riches. I've never needed a resource or a collaborator that I haven't been able to find, and not only find, but really had access to leaders in various fields, as well as some of the sort of highest end methodology training that is really around for clinical research. So in addition to my primary projects, I'm also a Duke Clinical Research Institute fellow, as well as pursuing a master's in health science through the clinical research training pathway. So far, it's been productive, enjoyable, educational, and I've been really lucky to benefit from Duke's resources in that way. What sets residents in Duke Vascular apart? I would say residents in Duke Vascular are set apart by the sense of fun that we have. I think, most programs are going to be full of people who are smart and want to take care of patients and, motivated and want to learn. But I do think that what really sets Duke residents apart is the fact that we really enjoy spending time together and spending time with the team. And in a field like vascular, especially at Duke, where the schedule the night before is almost never what happens the next day, it's really important to enjoy spending the time together and the twists and turns that the day might throw at you. What attracted you to the specialty of vascular surgery in the first place? I would say I was attracted to vascular surgery for sort of two main reasons. The first is the physiology and pathophysiology of the arterial and venous systems. I think it's just cool. I enjoy the physics that goes with it and the problem solving that you can start to get into once you understand the anatomy and physiology of the system. So from that aspect, it's just enjoyable. But I also really wanted to be taking care of a group of patients who I thought who needed care, especially in North Carolina, which, given its history of tobacco farming and a relatively heavy burden of comorbidities in the local population, there are a lot of folks around here who need vascular care, and it's a real privilege to get to work in a team with them and, with a bunch of other clinicians and physicians to try and get them the care that they need. How does the Duke program fit into your career goals? So I'm interested in being an academic vascular surgeon, and I think that saying that can be a little risky at times, because sometimes you get the academics or you get the surgeon, but you don't get both. And the reason why Duke is such a good fit for me is that I know that I'll graduate from here being able to do both. So both being able to do academics at a really high level with rigorous methodology in a way that actually makes a difference for my patients, and then also being able to operate in a way that is safe and effective, and in the best interest of my patients as well. How would you describe the attending-trainee relationship at Duke? So the attending-trainee relationship is an area of, it's very near and dear to my heart. I am the first Duke Vascular integrated resident, and I have felt from day one that the attendings are just deeply invested in me, both clinically in terms of research and personally, I just am constantly left with a sense of care from them. And it can't be easy to train people to be doing vascular surgery from day one, but they've never made it look hard. They've always been so patient with me. They've encouraged me when I need it, challenged me when I needed it. And it really does feel like a family to me. We're a small program, but I think everyone in Duke Vascular enjoys spending time together and helping each other out and helping each other be better. So it's been a real privilege.